Let's talk about lead placement. We're going to talk about lead 2, but we have to put at least 3 wires on, or 3 leads. Prep the skin, remove diaphoresis, remove oil with a 2x2, and rough that skin up with a 2x2 or 3M sandpaper, which will give you a better recording, preferably the patient laying flat, realizing they'll be probably semi-reclined. White goes on the right, smoke over fire, so white is on the right arm, black is on the left arm, red on the left leg. Most people move them closer to the shoulders. The reason we monitor this way is we monitor lead 2, which reflects the normal electrical conduction axis of the SA node firing down through the AV node through the ventricles, and that's from the right shoulder to the left leg at 60 degrees. In access talk, that's a positive 60 degrees as indicated on Einthoven's triangle. And as that electrical impulse travels from the SA node down through the ventricles, it's reflected by different waves on our EKG, starting with the SA node depolarizing, which is the upright, rounded P wave in lead 2. It should be no taller on a vertical axis than 2.5 little blocks. The time it takes for that impulse to travel starting in the SA node into the ventricles, having traveled through the AV node, is 0.12 seconds, noting that an intraventricular conduction lag exists when that time is between 0.10 and 0.12 seconds. Anything greater than 0.12 seconds is a bundle branch block, and we'll get to those when we cover the ventricles. The QRS is the depolarization or squeezing of the ventricles. Where that S wave meets the isoelectric line is the J point. We talk about that more in 12-lead interpretation. The T wave in lead 2 is pyramid-shaped and upright and should be spiked like a pyramid, but it can be rounded. We'll talk about morphology of T waves a little later. The R to R is just the distance or time between one R wave to the next, but ultimately gives us our heartbeat, our pulse, and we'll talk about counting beats in our next class. Looking at the paper, each little block on the horizontal axis is 0.04 seconds. There's 5 little blocks and 1 big block, hence 1 big block is 0.2 seconds. On the vertical axis, 1 big block is 1 millivolt. Electricity, as it increases, will get higher on the vertical axis. Getting heartbeats or heart rates or rhythm rates requires us to examine 3 to 4 different rules in interpreting rates. We can take a 6-second strip, count the number of R to Rs we have or number of QRSs we have, and times that by 6 to get our rate. Or we can divide large blocks by 300 or little blocks into 15 to get our rate. We'll cover more rates in the next section.